user experience, the future of the user experience in future health. It gives me great pleasure, ladies and gentlemen, to welcome onto the stage Dr. Giles Morrison, Clinical User Experience Association. Please come and join me on stage, Doctor.
Well, it's a pleasure to be here. As I've been introduced, my name is Dr. Giles Morrison. I work as a Clinical User Experience Specialist, and that's after working as a doctor for 3 years. And I realized that UX is still poorly understood within the healthcare sector. It's seen in many other industries, but it's vitally important to understand it in healthcare. So yeah, this is going to be my talk, just to get a bit of a gauge of the room. Who here is a clinician by some definition? Doctor, nurse, healthcare professional? Hands up. Nice and high so I know who you are. Wonderful. Who's in a management role within healthcare? Okay. Who works in user experience? Oh, that's wonderful. I'm going to be asking people actually what UX is, so you're going to get grilled. So, First key thing really is please stay in touch. There's a variety of means to stay in touch with me personally, but also with the Clinical UX Association, which I represent. I'll be discussing that a little bit more later on in my talk. Okay? And please do tweet. Twitter's very important. Stay connected with people. So the main headline to make regarding my talk is that optimized UX is vital for the future of healthcare. So don't get me wrong, that's not me saying that doctors are not more important, or nurses, or having money, or even a hospital building or anything like that. There's loads of parts that's needed to have a successful healthcare system. But what I'm going to be discussing today is just how important it is to have UX being at the forefront of what you're doing, to ensure that any healthcare intervention that you're doing to keep people well or to heal the sick, actually your efforts are fruitful. So there's a difference between knowing something and understanding. To know something is that you will understand, a variety of facts. For example, I know that my nephews don't like going to sleep late at night. I don't understand why. I can't fathom why they won't want to just sleep, because if it's midnight for me, I'm tired. But they will still want to run around if they get the opportunity to. So one of the big things that we do, we'll be discussing a bit more within user experience, is not just knowing what are the problems, but understanding them, trying to really get to the nitty-gritty, because through an understanding of a problem situation, or even a situation that just seems good already, how are you then going to improve it unless you fully understand it? Just the facts alone are not going to be enough. So, what is UX? And I'm going to put this to the floor now. Hands up, anyone going to give a definition of what user experience actually is? Don't be shy now. You're grinning, that means you've got an answer. Why are you shaking your head? That's not the answer. Has anybody else going to go? Yeah.
User experience would be the experience of the clinician on the other end, how they interface with technology, and how the other person on the other end interfaces with the technology, and that being the user experience, and how they use it, and how easy it is to use, and how they're trained.
Yes, this is true. I would argue it's still bigger than that. So just so that everybody heard, specifically the gentleman said that, what's your name, sorry? Elliot. So Elliot was saying that it's the clinician having a good experience, being able to achieve their tasks with technology. I would say that's a part of it. Next one.
I think one of the questions is to define who is the user. And that's part of it. Is the user the clinician?
Yes.
Is the user the patient? Is the user someone else within the organisation? So there's different experiences.
That's right.
Where you are in that channel.
That's right, that's right. Anybody else want to comment? Yeah, right at the back. Nice and loud now. I didn't hear that at all. Hang on, I'm coming. That's why I have a roaming mic. I like to be able to get into the crowd. Oh, there's a mic there.
Okay. I think evidence-based decision making.
Evidence-based decision making, that is important as well. So let's carry on. So UX obviously stands for user experience. I'll be a bit disappointed if anybody wasn't still sure what that actually was as an abbreviation. It relates to the experiences people have when interacting with the designed world. So when I say people, I mean any person. If I was really going to be very strict about it, I would say any sentient being, any living organism in fact, interacting with something that's been designed. So you're having an experience with my voice. When I speak loudly, you're able to understand what I'm saying. When I don't use the mic, some people can't hear me. There's an experience from that, based on the design of the microphone and my use of it, me interacting with it. There's a reaction that you have with the synthetic lighting here, which is very different from that light, which is right in my eyes. So it's looking at actually the experiences someone has with anything that someone is designing, because we have control over things that have been designed. I can only control the sun, or the lack thereof sun, control the rain, when I use something that I have made. I can't command the sun to go away or the rain to go away. I wish I could. Well, the rain, not so much the sun. But I don't have that power within me. But I can put on an umbrella, I can put on some sunglasses. Is that making sense? Wonderful. So, experience involves emotions, skills, and knowledge gained from an interaction. So right now, I'll hopefully feel that you're all feeling happy, having a positive emotion based on me talking. I'm exercising my skill of presenting and public speaking, and knowledge should be gained. Even people who are dealing with user experience, hearing my perspective of UX is going to shape their understanding, I would hope. Fingers crossed. So, interactions can be measured through three main ways: their usability, their accessibility, and pleasure. And I would argue that a deficit in any one of these is going to reduce your user experience. So usability is about the ease of use and learnability of anything that has been designed. So I was watching, was it Mnet movies just before coming in today, and I was struggling to turn on the TV. I had to press the power button, but it wasn't coming on. It wasn't really that usable. I was still struggling. As much as it should just be a power button, like any remote anywhere in the world, it was still giving me some stress. But that shouldn't have been happening. I should have been able to just get on with it, complete the task. Whereas the accessibility is that, I've got fingers to be able to use this clicker, but what if I didn't have a hand? You can watch plenty of videos online of burn victims or amputees or even people born with defects where they don't have hands. How are they supposed to change their slides? What would they do? It shouldn't be a barrier for someone to be able to give a presentation and control their own slides just because they don't have a hand. So accessibility, making sure that any genuine disability, even a perceived one, where someone who is of the elderly population thinks that perhaps they can't use an iPhone. That's a lot of nonsense. They should be able to use it. It's a phone. If a 3-year-old can use a phone and make phone calls like my nephew can, a 90-year-old should be as well. And then pleasure. People should actually enjoy using technology. Hands up a clinician who has enjoyed every single instance they've used technology at work. Hands up. I'm still looking. Hands up. That's what I thought. And this is terrible. You should enjoy using technology, because hands up, who's actually had at least one good experience with their phone today? Just today. And it's only, 10, 12 in the morning. That's good. That should be the case though with any time you interact with something that's been designed. You should have a good experience, even if you're doing something that's negative. I had to create the programs for my father when he passed away last year, the programs for his funeral. I had a good experience doing it, going through the pictures, designing the brochure, and actually getting them printed. Everything runs smoothly. That's a good experience, even when I was feeling down. So, quick way of demonstrating this now about usability is that usability and accessibility is great in this example of a highway in the UK, but it's not particularly fun, is it? It's not really the most exciting of views. Whereas here, it looks absolutely beautiful, but if you crash and try and use your phone, you're in trouble. I don't see anywhere to get a data signal there, to be honest. Whereas here, it's just great. It's clear direction of travel. You shouldn't be able to go on the other person's side of the road unless you're, closing your eyes or something. And it's a beautiful, beautiful view. That's how good UX should be, where everything is optimized. So what is user-centered design? So it's a design philosophy where the end user's needs, wants, and limitations are the focus of all stages of the design process. So right from the get-go, you're thinking about how am I impacting the many different people involved with the output of what I'm designing, be it a product or a service. Now let's explore this a bit more in the double diamond design process. Hands up if you're familiar with this process. Oh, wonderful, there is a hand. That's nice to see. Right, so you start with a problem or problem situation, or sometimes even just knowing that you want to optimize a situation. So it may not even be an actual problem. The first thing to do is to go through a discovery phase, to do some research, understand what's actually going on, what are all the facts that you can gather. And as you get those facts, you then go through a process of understanding it, defining the problem. When you've narrowed down to the problem, this is a cyclical process, by the way, and you can go backwards. You start defining what's actually the right problems to be solving. So if someone says to you, go and get me a plate of food, if you bring them some Malva pudding and they're diabetic, that's not a very good idea, is it? However, if you were to ask them some questions about what they like and how hungry they are and things like that, you would know actually what would be the best bit of food to do. But if you're a terrible cook, you're then going to need to decide actually how are you going to prepare this food? What are the different ingredients you're going to need to use, the different resources you would have to use. And as you go through that process of developing what's going to be the best solution, you then actually create it. And then you deliver this product or solution. And this process is also a cycle. And then you get to the right solution at the end. And this whole process can even be done as a cycle. You know, don't feel that just because you come up with what you think is the best solution, that it really actually is the best solution. And it ties in exactly with what all the clinicians would understand as patient-centered care. It's a medical philosophy where the patient's needs, wants, and limitations are the focus of all stages of their care. It's the same thing. And when I came to that eureka moment of how my clinical practice and my training experiences tied in to designing products and services in healthcare, it was a wonderful moment. The transferable nature of my skills into this industry. So patients like products, very briefly to go over, someone comes with a headache, you narrow it down, or even chest pain would be an example. In the back of my head I'm thinking, if you've got chest pain, you could have heartburn, you could have a heart attack, you could have coarctation of the aorta, you could have pneumothorax, you could have pneumonia. There's definitely a few clinicians who know what I'm on about, a few other people thinking, what the hell did that man just say? Anyway, you get more information from the patient, asking them questions, but then you do an examination. You know, I'll get the stethoscope out, I'll do a variety of investigations. I'll be able to do a chest CT or X-ray and the like. And then it finalizes down in a diagnosis and then give a treatment plan. And then you do a checkup to make sure everything's fine. The same thing happens when you're designing. You get a request to make a new website, you want to sell a variety of products, but who are you selling the products to? You do some user research with those people that are involved. And from that user research, you're going to come up with ideas of what could be done, and then you finalize on the best solution for them, and you start creating it. And then you do an evaluation to make sure that you've not missed out anything. And that process too is a cycle. I'll leave it up for a moment because I see a few phones out to take pictures. There you go. I will be sharing these slides, by the way. So what is a UX practitioner? What do I deal with? So it's a professional who optimizes the usability, accessibility, and pleasure of technology and services. So the UX is at the back of the room. Would you agree that's part of your job? Wonderful, I got a nod there, that's good news. It's more than that, but ultimately that's your job. There's loads of other soft skills that's involved, loads of other challenges that you face, like a lot of challenges that you face, but ultimately this is your job. You know, if you're dealing with UX, your job primarily is as a catalyst. So one definition of a catalyst is something that increases the rate of reaction in a process, but let's forget about the chemistry. Let's think more so about this definition. So a person or thing that precipitates an event. So a user experience professional should identify within a healthcare system that already exists or one that's going to be created, where are the problems and where are the opportunities to improve, and ensure that things start moving. So a product designer is supposed to do this, a manager is supposed to do this as well, but so does a UX practitioner. You know, we're problem solvers. We use design thinking, just like that double diamond design process. It's a way of us trying to identify what are the real problems and finding the best solutions to them. And by doing that, before loads of money is spent on creating a new solution, you're going to save a lot of time and a hell of a lot of money. There's plenty of stories of millions upon millions of pounds being wasted because we rush to a solution without fully understanding the problem and therefore shaping the solution to that. Another big part of what we do is to win users and influence stakeholders. So make sure we are champions of the end user. Could be the clinicians, could be the patients, could be non-clinicians, could be managers, making sure that they are on our side. So when we give them their product or service, they're happy and excited about it and just get on and use it. And this is the whole part with stakeholders as well, people that are holding the purse strings, people who are decision makers. You want them to be happy with what you're doing. Whoops, a daisy. So, big part of our role is about making people happier and enhancing lives. So, where we need to optimize UX, there's loads of places, and I want to skip through this a bit. Just to quickly just show you at a high level, there are so many opportunities to improve user experience in these 4 key areas. So, in a healthcare center, it could be a hospital, it could be community care. You're going to have clinicians of all types. You're going to have non-clinicians, the managers, the academics. You're going to have patients and carers, friends and relatives. Then there's specific targeted groups, people who are already sick or people who are at risk of being sick. Actually targeting them, you can look at their processes, look at the problems that they face, how can you improve their lives. And then the general public, it's just almost anything can be done in that space. And likewise, special situations, you might be working with astronauts, with deep sea divers, with coal miners. They have very specific health needs based on the work that they are doing. And then the projects, skip through that, but the main point is there are loads of places to be working in the healthcare sector. As I mentioned before, $320 billion is the market. There's a lot of money to be made because there's a lot of problems to be solved. And remember again, I said about the difference between knowing and understanding. For us to fully understand, we can't just lean on one's own understanding. So, for example, I've worked as a doctor for 3 years before going into user experience. I very much understand what clinicians go through when working on the wards or in community health. But I'm not a coder by trade. I can do some coding, but that's not my main profession. I'm not the main manager in teams. I don't always have to hold control over the budgets. But there's other people that do. And by us working together, we as a team understand all of the problems and the ways to solve those problems. So this just helps to quickly explain the fact that there's the business side, which could be the hospital or government and startups, which are providing the need for a new product or solution to be created. The patients are going to be major stakeholders that are going to explain what their needs are as well, because you're serving them. And who is creating the product is going to be, again, it could be hospitals, startups, or corporations, including the government. And there's a variety of professionals and people involved in all 3 areas, which all need to keep in mind the end user consumer at the very center of what they're doing. And by working together, they'll have better outcomes. So a bit about the Clinical User Experience Association, the CUXA. Some people abbreviate to CUXA. It is not CUXA, it is the CUXA. We had a big meeting, the first event we did back in November last year, and the majority members said CUXA is the abbreviation that they would like to use, so that's the one we go with. So it's the leading authority on healthcare user experience. So we're a community of clinicians, UX specialists, IT professionals all over the world passionate about healthcare user experience. And we are global. We started off in London, where I was born and raised, but we've got 2 teams here in South Africa, one in Cape Town and one in Johannesburg. We're as well expanding to east side of America. We've got a team building in the Netherlands, also in Poland. And we're also, in fact, next week I'm going to be heading off to Chile, where I'll be doing a talk out there. So we are a global community. It's wonderful how it's growing. And we've got an event tomorrow in the evening after the conference here, where I'll be discussing about the impact of AI on healthcare, and also a discussion about the national health insurance. So this event is free to attend. You can get your ticket on Meetup if you go to the Clinical CUXA Johannesburg Meetup group, or just come and find me. But it's free. Just turn up. There'll be food as well. Everybody likes to eat, I'm pretty certain. So yeah, do come along. It's going to be a really, really wonderful event. And you will be able to leave earlier so that you can get the last train if necessary from Pretoria. So yeah, optimized UX is vital for the future of healthcare. Please stay in touch. It's been a pleasure. Thank you.
Absolutely fantastic. And just in terms of other industries that get the user experience right, does anybody get it right?
I think the aviation industry's done it best.
Are you kidding me? Have you ever lost luggage at Heathrow?
See, this is the thing though, when we look at what's most important is actually people not dying on a plane. They do that exceptionally well. They do that exceptionally well. My flight here was a little bit bumpy, but never did I feel like it was going to fall out of the sky.
But jokes aside, I do get what you're saying about the aviation industry. I mean, if you look at now, you know, everything is almost digital. If you've got a smartphone, you can check in with your smartphone. We've done away with printing those, you know, those red boarding cards. And interestingly enough, I had a fantastic user experience. I was in New York last week, and at JFK, they've completely automated the passport control. So you arrive, you scan your own passport, it prints out a little ticket, and the process is seamless, and it works.
Yeah, a big thing actually with British Airways, I think EasyJet as well in the UK, is self-bag drop. It takes about 60 seconds from when you go up to the machine to put in your passport, to get your ticket, to put in your luggage, you weigh it to make sure that's within weight, and then they take it away 60 seconds. Can you imagine how long it normally takes to just check in baggage here at the airport? It's an absolute nightmare. So, and that's just one part of it, because you've explained about when the end user as a passenger on the plane actually is interacting with the airport services. That's getting a lot better. But then I see it from the pilot point of view. They're really, really important stakeholder in the whole of the aviation industry. Have you actually ever looked at a cockpit of a plane? It is probably the most confusing thing I've ever seen in my life. And this is someone who's gone in to have to, you know, move bowels and stuff around in a human being to try and figure out what's wrong with them. That I can understand. I can't understand the cockpit at all. But these pilots do, and they are really efficient and safe. And it's not just years of training, it's that things have been optimized so that they can reach things easily. The ergonomics of it has been designed with loads of user research. But how much user research and looking at the ergonomics has been done for user interface in a hospital setting? It's still very rare.
Interesting stuff, interesting stuff. Doc, thank you so much. Really great talk. And yeah, for those of you who can make it tomorrow evening, it's going to be a very interesting one.